For the agenda, we will begin with a little bit of introduction. So I'll just introduce Dr. Maria Segui Gomez. Thank you for coming, Maria. We will take a little bit of presentation as the first 15 or 20 minutes from Maria, and then we shall follow with who's chat AI. We will follow with a little bit of dialogue and questions and answers. So if you do have questions, please feel free to sort of raise your hands up or also put it in the chat, and I shall coordinate that. So other than that, I will just start with a little bit of introductions to Maria before I give the floor to her. So I don't think she's a stranger to any of you guys. She's a physician and doctor in public health who trained at the University of Barcelona, Spain, and Harvard University. Following academic appointments at Navarra, she became a tenured professor in preventive medicine and public health. Dr. Segui Gomez's research focuses on the prevention of injuries, mostly road traffic crashes. She conducted her research at Harvard University, Johns Hopkins University, and Universidad de Navarra, where she established the European Center for Injury Prevention, which became a WHO collaboration center. She has authored more than 200 works in scientific papers and books. And in 2011, Dr. Segui Gomez was appointed as General Director for Public Health, Drug Dependencies, and Consumer Affairs under the Regional Minister of Health in Castilla-La Mancha in Spain. And in 2012, she was appointed as General Director for Traffic for Spain under the Ministry of Interior, where she supervised a budget of approximately 800 million euros yearly. Under her directorship, road fatalities were reduced by 18% in Spain. And since 2016, she serves as an international road safety consultant, having worked for the Federal International de Automobile, FIA, and its high-level panel, and the World Bank. She currently works for WHO, where she coordinated the 2023 Global Status Report on Road Safety. So thank you very much, Dr. Maria Gomez. Thank you for coming. And I'm not sure if Matt is, as I speak, Matt enters in. So we have the two chief architects here of the Road Safety Global Status Report. So with that, I give the floor to you, Maria. Thank you.
Hi, Etsani. Thanks so much for the invitation. And it's very good to see so many good faces and good names. And those of you that I don't know, I'm very, very pleased to meet you. And I'm Maria, not .ai. This is a real Maria. Acknowledging from the start that in as many different words that life has taken me, the Global Status Report is one of the most challenging ones. And so my kudos to Maggie, who's in the audience, because she went through 3 of these. And so I do have a much different understanding of what she went through. Hi, Maggie. So I was asked by you to present on the Global Status Report. Although I presume many of you have already taken a look at it, if not witnessed the launch that took place in December 13th. So let me use the same basis for the presentation, but I have peppered it with a few additional elements. And I do look forward to the clarification or the discussion that follows the presentation. I understand I can share my screen, and that I will minimize your window so that you can see my full slides. Is that what you're seeing now?
Can see it. Yes. Thank you, Maria.
Yes. Now, of course, I don't see any of you now. So if there is anything pressing, please raise your voice. Otherwise, I won't be seeing your messages or your hands up or whatever. Feel free to interrupt me if need be. So as I said, this is a short overview of the status report, which, as you know, is meant to provide us with an overview of the road safety situation worldwide. It's meant to be a consultative process whereby member states submit their information, and it is a monitoring tool as requested by the United Nations General Assembly. Since the onset of the 2011-2020 Decade of Action, and many of you might remember that icon that was launched back then. On this slide, you have a little summary of what has happened in terms of global monitoring of road safety. I want to remind you of the baseline 2004 report, among other things, because we are 20 years into its publication, and I understand that there is some events being prepared in the context of the United Nations Road Safety Collaboration, to commemorate this. But following that 2004 report, which was an aggregated report, 2009 was the launch of the first global status report that included these country profiles that we have used so much. And since then, following the first of the UN General Assembly resolutions, we have had it 2013, 15, 18, and then our 2023 report anchored also on the continuity of the request on the second UN General Assembly resolution. In general, we have had a very high member state participation throughout these years, reaching always more than 97% of the world population. And on this map, you can see that as of 2023, all member states in the world have submitted at least once information on the road safety status. More importantly, the majority of the countries, 140 of them, have submitted information the 5 times they have been requested. And I do take this opportunity to raise this in consideration of the fact that despite our complaint that road safety tends to be overseen, the fact of the matter is that the participation in this very laborious task is remarkably high. And it's always hateful to compare, but I believe now that the Global Status Report is one of the longest lasting and most participated global status report within WHO, regardless of the disease. It is not one of the most downloaded ones, but it is one of the most perdurable products. The report relies on 3 data sources, a questionnaire that is sent to each of the countries via the formality of government designation of a national focal data point, who might in turn get him or herself a team of associates to collaborate with. The second data point is the WHO estimated fatalities on the road, which for a time competed with other WHO estimations under the GHE category and the University of Washington Global Burden of Disease estimations, but things are converging now. But regardless of that, the fact of the matter is that this is the second data source. And then a third data entry point are the external data sources that we compel to provide you with information on income level or population or corruption index or all these other things that somehow, some way make it into the analysis and the indicators. And so with this 5th report, we come to the news that our estimated deaths on the roads is 1.19. And I will come back to this figure in the next 3 slides, because I do not want you to compare this against what you might have in mind from the previous report. The important thing that I want to present on this slide is that these 1.19 million deaths are mostly happening among individuals ages 18 to 59, and this is very important. For all ages combined, road traffic crashes happen to be the 12th leading cause of death globally, as per the 2019 best estimates we have on the subject. And sadly enough, these road injuries continue to be the #1 cause of death for children and youth up to 29 years of age. how these deaths fare in terms of region and in terms of income is on this graph, which you probably have seen before. Please do remember that the African region for WHO is not the African continent, but the sub-Saharan African, because the Northern African countries are included in the so-called Eastern Mediterranean region. And also bear in mind that the European region is the widely defined European region, ranging from Portugal to Russia. So we are not talking EU, but the broader European scope. So it is actually the Southeast Asia region and the Western Pacific region that bear most of these deaths, with Africa and the Eastern Mediterranean region and the Americas on the second tier of magnitude. And it is not surprising to most of you, but it is the European region, the region with the lowest % of the deaths, and what comes next will be even more relevant in terms of the reduction over time. But let's pause here for a second, because I would imagine that several of you have questions on this issue. Here you have the trend as it has been estimated in 2023 with the best available data for all years past. Every time WHO, the Road Safety Unit, and DDI, the Division of Data and Statistics Unit, come together to do these estimations, they do the full series. Every time the full series is revised. And this line represents the best estimate for these 21 years with the data available in 2023. You have the point estimate of these deaths. This 1.9 million is the estimate for 2021, and we present you with the 95% confidence intervals, just to keep in mind that this is an estimation and therefore there is a mathematical modeling error. Shadowed in yellow is the years that we have considered in relation to the decade of action, and this fifth report has the advantage of taking stock of this decade, hoping also to become the baseline for the second decade. And on this line, I want to put a few points. 1.19 is the estimated deaths for 2021, which is an increase from the lowest ever in history, 1.11 million deaths happening in 2020, after a big drop since 2019, and we all can relate this to the mobility restrictions in relation to COVID-19. More importantly, I want to call your attention to the estimated number of deaths for natural year 2016, which is now to be 1.21. And this is the number that you have to replace in your heads of the 1.35 that was published in the peer report. As with the best data we have now, the estimated number of deaths in 2016, again, was 1.21. And if we go back to the beginning of the decade, that was the highest that we can monitor in this modeling process. We estimated the number of deaths back then to be 125, and you might be a bit surprised to see that actually in 2021, we are back at the same number of deaths that we estimate existed in the year 2000. So the story is that wherever it is that we started, there was an increase, a continued increase, reaching 1.25 at the beginning of the decade, the declaration of the decade, a peak the following year at 2026, and then somewhat of a decline that becomes sharp around COVID, but goes back to 119. And it is this difference between 125 and 119 that makes for the 5% that I have described before. And I hope this makes sense to all of you, and that it's clear why we're changing the numbers. Now, this 5% global reduction is an average. It's an average of the reductions or the increases happening in different regions. This is why I talked about Europe before. As you can see, during the decade 2011 to 2021, the region that dropped the most is the European region. And this is quite significant because not only they are at the lowest now, but they started at the lowest. So the region with the lowest number of fatalities had the greatest decrease in those fatalities over the last 10 years. Western Pacific region and Eastern Mediterranean region decreased a bit. Really not much significant changes in the Southeast Asia or the region of the Americas, but an increase in the number of deaths in the region of Africa, 17% increase during that time. If instead of regions, we zoom in into member states, we see that those reductions happen across income levels. Actually, this is quite hopeful because we see low-income countries reducing their estimated number of deaths in this 10 years period, whereas we see that there are other countries where the number of deaths are increasing. And this is what you don't have in the report, but here you go. You do have in the report the names of the 10 countries who actually managed to decrease their deaths by 50% or higher. That's not news. But what you don't have in the report is the names of the 15 other countries who did not reach 50%, but were in the 40 to 49% range decrease. And these are Congo and Greece and Kazakhstan, Lebanon, Maldives, Mauritania, Montenegro, Oman, Poland, the Republic of Korea, the Republic of Moldova, Singapore, Thailand, Turkmenistan, and Vietnam. And I do hope that you all take interest in looking into these other countries to explore what might have happened in them. On the other side of the coin, we have the countries whose estimated deaths increased by 50% or higher. And here you have the names. 9 of these names are in the African region and 5 others are in the Eastern Mediterranean region. Even more importantly or more remarkably than the increases or the decreases in the extremes, I would like to call your attention to 2 very different experiences. On the one hand, we have China and Brazil, both lowering their estimated deaths by 10 and 23% respectively, and India and the USA, where both have increased their expected deaths, their estimated deaths by 2 and 33% respectively. And so that is quite some food for thought. Moving on, something that has been presented since the first report continues to hold true. It is the countries with the fewest vehicles and that bear a very disproportionately high percent of the fatalities. The novelty on this graph is that we added one more pie. That is the pie that talks about infrastructure, and in particular, we chose to represent the percent of paved roads that countries might have reported on. And in this particular case, low-income countries also bear a very small percent of these paved roads. And the second novelty in the pie is that instead of 3 income categories, we spread countries along 4 categories in following with more recent practices and trying to balance out as where most of the countries are shifting is in these lower middle incomes, forgive me. We also peppered the report with external information on self-reported behaviors, and we came to learn that most of people claim to be pedestrians and public transport users, and a smaller percent of people claim to be drivers of 4-wheel vehicles or users or 2-3-wheel users. Unfortunately, in that questionnaire, we could not extract data on bicyclists yet. Hopefully they will collect this data in coming years. But sadly, when we ask our countries on their policies for promoting pedestrian and public transport users, only 47 claim to have any policies on these matters. And most importantly, it continues to be the case that most of these deaths that we are estimating are not passenger car users. They are users outside the passenger car, and that represents a dilemma that we need to address. We need we cannot keep calling them vulnerable road users. They are most of the users. It's just that a fraction of the vehicles are causing great impacts in the other users of the road. Another novelty we brought in was an assessment of this infrastructure, both in terms of development of the infrastructure as well as the quality of the infrastructure. And we partner with your brothers in Conception, IRAB, to confirm that of the roads assessed in countries participating in our surveys, the few or lots of kilometers that have been assessed in regards to the 3-star level or higher only reaches 40% when we focus on the safety of the four-wheeler users. But when we look at those roads and their safety in regards to power 2-, 3-wheeler cyclists or pedestrians, the coverage of those 3-star or higher ratings drops by at least half. And so the point being, we are still failing to produce roads that are reasonably safe, even for the type of users we have focused most in the past decades, much less for the bulk of the users and the bulk of the victims. We also zoom in vehicle safety standards. In the past, we used to rely on whether the countries had signed the conventions, international conventions in regards to vehicle safety. We did that this time, but in addition, we asked the country about the legislation in their books regarding vehicle safety. And what we came to learn is that actually, even if we focus on 5 selected safety standards, and we add a 6 criteria such as the vehicle inspection assessment, it is actually a minority of the member states who have those laws in the books. All in all, it is only 35 member states that have all 5 vehicle-specific safety laws in their books. So much way to go. Very importantly, because we have the addition to the conventions and the national legislation, we managed to be able to confront them head to head, and came to learn of the reality that there are countries who might have signed the convention, adhered to the convention, but have never developed the country-specific legislation to translate that into their books. Whether a country has a law and has not signed the convention is a different situation, but we can look into that in more detail. But it calls my attention greatly that a country will go the process of adhering to a convention and will not then eventually put that back into the country. We did go into the traditional sphere of road user behavior and checked on the number and quality of legislation pertaining to drink and driving and motorcycle helmet and seat belts, child restraints, and speed limits, and so that since the last status report, it is actually 25 countries who have amended one of their laws. So the speed of improvement is relatively slow. All in all, out of 6 laws and 194 member states, we only have 140 countries who have at least one of these laws meeting the so-called best practice as determined by WHO legal criteria. More gravely, it is only 6 countries in the world who have all these laws meeting this WHO best practice. And that is quite that shows quite some ways to go. I'm wrapping up because we do continue to face substantial challenges. The one thing that I wish we could have done is to delve into the non-fatal injuries. We have not managed to. However, we have collected information on whether the country has any information on their non-fatal injuries, standard or non-standard across them. And the reality is that nearly a third of the member states do not collect any data on these injuries. But for the 70% that do, let's hope that in coming months and years we can produce some operational definition that can be followed by all. And the second challenge I want to mention is that all the figures that I have mentioned in regards to fatalities relate to the estimated fatalities as I have described. Yet the countries report on what they have as their official statistics for road traffic deaths. And the gap between the reported fatalities and the estimated fatalities continues to be huge. This discrepancy exists since the first report ever, and as you can tell, there hasn't been much of a convergence. And this is not to say that the estimation is right and the reporting is wrong. What this is to say is that there remains to be very thorough work to determine how countries can trace in more significant ways the number of their fatalities, because you all, international organization players, go to the countries with the WHO figure in mind, and in many occasions, and correct me if this is not what happens to you, is that you find a very big first obstacle in your conversations because the policymakers in those countries deny the WHO estimation and linger and hinger on the reported. And there is already a twofold difference. On average, the difference can be much larger, as very many countries have no difference whatsoever. And so this is it. Global progress, yes, 5%, still far from the 50% that we had set ourselves as a target. There is some hope as we see regions and lower income countries making significant strides ahead, but definitely the need to focus on this infrastructure and these vehicles matters on top of continued working on the behavioral issues. And yes, we can frame it all under the safe systems paradigm, but the important message is that there is so much more that can be done and that we know that works and is not done and is not happening, that I think we can consider ourselves with a busy work agenda ahead. Thank you so much. You might have gotten already a copy of our mobile application, but there will be other products, and you know the landing page where you can have, actually this is active, the page is active. I should delete this currently inactive word. And I thank you for your time and attention and everything else. Stop sharing so that I can see you back, and glad to answer to any questions. Thank you very much.
Thank you, Maria. That was so packed full of information. And we can start having a bit of dialogue. There are a couple of questions on the chat there. But before, perhaps, just a bit of takeaways for myself. I mean, I think the drop of 5% to 1.19 is encouraging. And you mentioned about the change from the 1.35 that we know so well to 1.21. And unfortunately as well, we learn of the leading cause of death for children and youth to 5 to 29 years. But the biggest surprise for me was that 10 countries were able to reach that 50%, which has been good. And you listed those out, the likes of Brunei, Denmark, Japan, Lithuania. But also, unsurprisingly, the 66 countries that lag behind, 28 of those was in the African region. But for you, Maria, who sees this all in its entirety, what has been the biggest surprise for you?
The biggest surprise for me is actually the fact that knowing what we know about vehicle safety and knowing what we know about infrastructure safety, we are so far behind. We are so far behind. I mean, realizing that we are exporting to Africa vehicles that are so clearly subpart, it's just very worrying, because we saw what's going on in there. We saw the increase, and it can only get worse. The 35 countries meeting all these safety standards are a gem, but everybody else is producing subpar vehicles, and those are going to be with us for decades. So that to me was the most striking finding, seeing so little penetration of measures that there is no question work and substantively work.
You also mentioned about sort of the work of IRAP and that collaborated with this, and about the 10 million roads that was sort of investigated, and out of those was only 0.2 was readily available for sort of dedicated cycling lanes. Can you speak a little bit more about that?
Yes. Well, actually, that data come from the countries. The countries, we asked them for the first time, we asked them to tell us about their network. And that was a bit of a challenge, because not everybody speaks the same language when it comes to measuring roads and kilometers and types of roads. But anyway, we got to ask them, and one of the specific questions was dedicated cycle lanes. And so the 0.2% that you mentioned is actually a country-driven measure. I'm not aware of IRAP measuring the 3-star level of cyclist-only lanes. I understand that the information we got from IRAP was on the roads they assess, and those are open roads, how many of them meet those standards for cyclists, which are two separate elements. But yes, the countries report very few kilometers of cycling-specific lanes, and the assessment of open roads regarding cycling is not very promising.
I see. Only 0.2. We'll start with a couple. There's a few questions on the chat. I'll just read it out to you, Maria. I don't know if you can see it. This is one's from Molly, yours. Hi, Molly. Is there a resource to learn more about exactly what has been done by the successful countries? I mentioned about the 10 countries that was able to drastically reduce theirs by 50%. And would be great to have case examples to draw on towards achieving 50 by 30. This is an open question, of course, to everyone else as well on the floor. We have a lot of experts here joining us. So, but Maria, do you have anything towards that, perhaps?
Well, the first thing I want to say is that the purpose of the report is precisely to gather the data and to present the status of the situation. It is not in the scope of the report to come up with the research to prove what's more effective or what's more successful. We do encourage all of you to actually get that going. Yes, you have the nearly 200 indicators that we publish in the context of the report and the country profiles. In the meantime, you have most of them in the mobile application, but eventually you'll have the raw data for you to download. And that is a snapshot of all the data that we collected. On the landing page I mentioned, you have the questionnaire that we used. Feel free to browse through it. And if there is any particular data element that we did not make into an indicator, because of time and space limitations, but you are still interested in analyzing, let us know, and we'll happily share it with you. Because again, the point is, let's now get on the second layer of work, which is let's start evaluating what makes things happen and what impact do they have on the safety of the population circulating in those countries. So this is a long answer to an otherwise very specific question, which is no, I don't know yet what it's the difference between those 10 countries and the rest. However, I will call to your attention that many of these countries are in the European region, and that takes me to one of hypotheses on this overall approach on the importance of infrastructure and vehicle safety. And so, anyway, I'm heading there myself, but I'm challenging you to walk that walk with us.
Thank you, Maria. And yeah, I was kind of surprised that in the mix between the 10 countries, for example, Norway, Brunei, Denmark, Japan, I mean, you can see that they would probably have a high sort of capacity and investment level that can do that, and political will. But within that as well, there is Venezuela, Trinidad and Tobago, and UAE. So that's actually kind of encouraging as well to see that. Anyone's got anything to add on this question?
As an answer, that's a very good point. I don't know that it is only a matter of resources, but also guidelines. Please remember that in the context of the European Union countries and peripheral countries, there are very strong policy directives on what it is that needs to be done. So it's not just a matter of having the money to do it, it's also to using the money in a very particular way. But in the particular case of Venezuela, I have to say that Venezuela shared very limited information on their interventions. So I'm afraid Venezuela will remain a little mystery for us, because there is little we can learn as there is little they reported. But there are other countries that I wish we do go back and check better on what it is that they did. I mean, it would be very nice to do like a pair comparison. Let's pick up 4 of the good performing countries and find countries with similar population and similar income level that went the opposite direction, and what are the most striking differences in these past years, right? That would be a very first step.
Thank you, Maria. Dennis, do you want to perhaps just read out or say again to the floor about your question?
Yeah, thank you very much. And thank you very much for the presentation. It was excellent. So you spoke a little bit about the competition, I think you said, between GBD figures and the GSRS estimates, and that maybe they're coming together now, they're kind of converging. And I wanted to know, in what way are they converging? Is that more of a methodological convergence? So are they doing things in the same or more of the same way? Or is it, you know, the estimates are converging because improvements in the models are bringing them closer to the true value? So what's the reason for that convergence, and how are they kind of collaborating or coming together?
Well, my first answer is that it is a convergence on the methodology, and it's both the method and the data that fits the method. But actually, a couple of years ago now, there was a memorandum of understanding signed between WHO and IHME, and that can only work and that can only be good for all of us. And the person who's now heading the WHO DDI division actually comes from that group. So there is clearly an effort to standardize methodologies. Only to say that it is hard enough to develop the method to have both and have both delivering slightly different results. I think that makes policy very, very, very complex. So I'm very pleased to see that convergence at the higher level. And when it comes to the unit, the injury unit, SAM, Safe and Mobility Unit, within WHO, we are not doing any isolated modeling on our own. We are folding 100% under the statistics division of WHO. So there is only one estimate coming out of WHO, which ideally is every time closer to the estimates that are coming out of IHME. I hope I have answered correctly.
Thank you.
You're welcome.
Thank you for that question, Dennis. Anything to add to that? Maybe I know Matt Spillane, you're here as well, and Margie, I know you contributed to the report too. If not, a great question from Sana of yours, and I'm deeply interested in this one too. Maria, how can we access disaggregated data by age coming from the Global Status Report? Yours is interested in learning about what exactly is affecting youth, so we can support developing concrete action to continue advocating. Same case with children as well. You mentioned there that I think the XLS data is probably available. Would you have that for us to?
We would have, and they would need to request it, but we would have the answers from the countries with regards to the age distribution of their fatalities. For those countries who deliver that information, we would have that available. The age categories we ask for might or might not be the exact ones that you're looking for, but whatever we got, we will be happy to share. There is an email address, sam@who.it. Let me just put it in here.
Yeah, please. Yeah.
So if there is anything that you see of relevance, feel free. That's the generic email, and I recommend that you use the generic email because that's the best way for us to channel the request and make sure that nothing gets lost in the game. Okay, let me just double check on the age categories for you, but. So, for example, it is 0 to 4, 5 to 14, 15 to 17, 18 to 29, 30 to 44, 45 to 59. So it might not be necessarily what you want, but it is more than in other occasions, that's for sure.
Thank you,
It's
Maria.
also interesting. It's also interesting to learn that we ask about the combination of age and user type, and the number of countries that were able to produce that combination is really a fraction. So when it comes to assisting countries developing their data systems, it might be important to know what the baseline is. I mean, there is a large number of countries who cannot cross age and user type, for example.
Margie, you got something to add?
Yeah, I just thanks, Maria, for the presentation and my commiserations on the process. Yeah, 3 strikes and I was out. So yeah, this whole discussion around what's available for children has come up, and it's a discussion I've been having with UNICEF as well. And the ability to disaggregate the data is pretty limited, isn't it? Because you've got that reported data on the age categories you've just told us, but that's all underreported anyway. It's before it's been modeled, etc., etc. So I think as far as the usefulness of the report is concerned, is it would have to be looked at in conjunction with other databases, possibly GBD 21, GHE, as you've said. So for the numbers bit to disaggregate by sex and age. But what is interesting is that we can look, and I think UNICEF are about to do this with WHO, look at what policies there are that are specific for children and where those policies are currently being implemented, and to see where the gaps are for those. Yeah, just to let you know that that's probably on the cards.
Sure. And I agree completely with you on the fact that besides the description on the victims that are of different ages and possibly the different ages and the user type, the richness of the data that we collected is not that. It is on the policies. And I'm happy to tell you that we didn't include it in the report, but there is a lot on helmet and children. Which we could exploit further. And there is a lot on child restraints. That's another of the nightmares of the report, the child restraint legislation. And there, everything needs to be done because the degree of coverage of those laws is just terrible, both for the motorcycle users and the passenger car users. Indeed.
Thank you, Maria and Marty. Jim, you have your hand up, please. Good.
Yeah, thank you so much. Great report. Really appreciate the detail you've got there. Depressing, of course, but good to see the updated figures. I just wanted to pick up the point about the European data, about it getting safer. Because although that's a positive thing, of course, what we also know from the European data separately is that it hasn't got safer to be a pedestrian.
Yeah.
And not for 20 years. And so I think we also have to be quite careful how we look at this data and imagine that, you know, certain places are getting better. They're getting better overall, but actually pedestrians haven't got safer anywhere in the world, as far as I'm aware, or not that it's been distinguished about. And we've done some work through the PATH initiative, which is the Partnership for Active Travel and Health, which Jill's on the call, Bron's on the call here. Number of partners looking at this. We've looked at policies, and we concur with your headlines that about half of countries tend to have a policy for active travel, supporting walking and cycling. But when we looked into the detail of those policies, only 18% of countries have a commitment in their objectives to make it safer. And so, you know, having a policy is one thing, and you're highlighting that in the report, but actually if only 18% of not just of policies, but about 18% of all countries, you know, so it's only about 9% of the, well, it's only, yeah, it's a very small percentage of those even got a policy, have a commitment to road safety, improving safety conditions for pedestrians and cyclists. You know, we need to keep digging deeper and deeper, that's my point, and recognize that even the positive stories have got shadows in them, and we need to expose them.
Absolutely, and first let me congratulate you on the background that you have. It makes you look very brainy. But I completely agree with your comment, Jim. And I think that it is precisely because we are in this transitional period where we are trying to, on the one hand, promote physical activity for very many good reasons, but at the same time, we seem to be continuing to focusing our policies on the safety of the occupant of a four-wheel car. There is a disconnect. If we are really serious about safety, we need to move outside of the car because most of the deaths are happening outside there. And so what do we do to promote walking that is safe? What do we do to promote bicycling that is safe? What do we do if motorbikes are to stay? What are we going to do with them to make them safer, and how do they interact with the other users? And so I personally have a preference not to use the term vulnerable road user anymore, because they're by far the majority anyway of everything. So why would I put them in the special box? It is the other users who are the minority, and we need to balance out our policies in that same proportion.
Danielle, do you want to chime in?
Yes, no, thanks for the great presentation. It's all, I agree with Jim that it's kind of depressive, but yeah, that's the reality. Now, I just wanted to make a point or ask a question, like for us all to think that, well, like watching the presentation just makes me, we all know, but it makes clear that we are dealing with like a multi-sectoral problem that it goes from, like, it's very complex. It goes from several infrastructural issues that from the lack of adequate public transit to bad quality of infrastructure, and to the political and economic power of the car and the motorcycle industry, right? So it's not only the safety itself, it's a huge problem. Like if in Brazil, for example, well, I didn't introduce myself. I'm Danielle. I work at ITDP in Brazil. And we are seeing like a huge growth on motorcycle use in places where the public transit is not adequate or it's not enough, right? And that leads to road safety issues. And so like, how can we, I guess we need to integrate more all these agendas. And my question is to like, does the WHO has any agenda on that, on trying to intersect the, I don't know, dealing with other UN bodies, and how could we improve that, make it more efficient? Because I don't think we're gonna like make that by ourselves. We need more players.
I agree, and of course, Matt's is also on the call. So if he wants to step in, he can. Because remember, I'm a consultant, so I don't necessarily speak on behalf of WHO. But firstly, Brazil is actually one of the big ones that has done well. Remember, I told China and Brazil have had some significant good results. So congratulations on that. But what you're pointing out is relevant worldwide. I don't think safety is going any place per se. Safety has to be a part of a larger speech, a larger policy framework. And I do know that at least from NAN's part, there is a big push to integrate with the big policy discussions going on at the ITF, the International Transportation Forum, or the World Bank, or the other big funders of infrastructure, or even donors of some loans to manufacturers, because it's clearly the case that we need to walk upstream. Yes, user behavior is all very important, but that is more downstream. We need to go up. Okay, what's the mobility pattern that we want for our countries, and how does that mobility pattern then produce safety results that we want to prevent happening? But definitely we need to get out of our comfort zone to move to the territory of energy debates. What's the energy? Which energy are we going to be using? Transportation, big policy issues, infrastructure development. It's not in the report, but because we ask on infrastructure, we also ask on the evolution of the infrastructure in the past 10 years. And then we actually crisscross that information with information collected by IRF, the International Road Federation. And truth is that we are building roads left and right. In the past 10 years, a lot has been built. Well, under which conditions is it being built? Because we know better. And how and when are we going to tackle the standards of the roads that we are building in 2024 with money of 2024? And how come are we accepting anything less than some minimum standard? And this, which seems a very basic statement, is very far from reality. We are building miserable roads left and right.
And perhaps we shouldn't be building roads at all. We should be building more infrastructure towards public transport and mass rapid transit. So, and this is the thing
that's a debate. That's a debate.
And that's what I'm very, yeah, and that's what I'm very interested in. And on also the CHI on what actually works, guys. So, you know, from a programmatic level, and then perhaps become a catalyst for change towards something bigger, like you said, upstream, Maria, to sort of the legislative policy changes. And I hope we haven't had a chance to sort of unpack that a bit further, but I think that's up to us as a community to sort of like analyze this report and sort of go deeper into it. And so on that as well, Corinne is asking on the chat, do we know yet when the country reports will be published on the website? Will there be?
I wish I had the answer to that sooner than later, but the second question I can ask very satisfactorily, because yes, the country profile will contain the 2021 data and an indicator of the change for that indicator since 2011. So it will be like an increase or a decrease, or stays the same, or there is a change. So the country profile has the evolution information in as succinct and pictographic as possible, so as not to make that huge. And it is, I have been saying this for the past few weeks, but promise it is only a matter of a few weeks that the country profiles will be on the website. And the good news is that they will be downloadable on a one-by-one basis. So you will be able to pick and choose which country profiles you want to download. You don't need to get the 196 of them.
Thank you, Maria. One last question from me, and I think we're out for time. So with everything that we know today, and I know there's still a lot more to unpack, but just as a little game, if I was a billionaire philanthropist other than Michael Bloomberg, with a passion for safer and sustainable mobility, where would I invest the bulk of my funds to get the best return on investment and bang for my buck? I mean, you've got so many things coming out of this, like clearly we should invest in lower middle income countries, 92% death occurring there, 3 times the risk of death. Probably should be in Africa, maybe, which is lagging behind, 17% change. Negative change. Maybe a focus on modal shift to cycling, walking, public transport, perhaps. Only 47 countries have those in their national strategies. Leading cause of death is, still children and youth, so maybe a focus on that. Is it the, advocacy, evidence-based programs that act as a catalyst for fully funded legislative change? What do you think it should be? And if I had $100 million, where would I invest? Anyone want to answer?
With $100 million, you wouldn't go back very far.
No, I won't, but would it start something? What would that program look like? Probably need another hour, but
it's
a lot.
There is a lot to be done in lots of places, but actually, I will say something that might not be the most ideologically suited answer. Sure. But a very practical one. I would get Mexico, Brazil, and Argentina to sign the UN Conventions on Vehicle Safety. And with that, I would get every new vehicle for the whole Central and South America covered for the next 20 years. And then we move to other things. But I think it's terribly detrimental that we have these huge manufacturers not
eco standards.
Exactly. Not
Is Global NCAP on the call? I'll
well, actually, of the whole region, Colombia is the first country that has gone far enough to have the president sign the law to adhere to the UN 1958 convention. And it's been sitting in some higher order tribunal for 1 year now. So the forces are holding that to be finally sent to Geneva. Forces with capital F.
Maria, thank you so much. And I will continue asking our partners on what works, what doesn't, what we should do more of. And you will see that theme continue on throughout the year and on where we will be as a CHI. A gentle reminder, we'll be at the Transforming Transportation and hopefully as well in Safety 2024. Margie, I know you want me to say that. So there it is. So we'll keep the conversation going. And lastly, just for myself, feedback on COP. Is this useful? Is this unhelpful? Is this useless? Let me know. Any other themes you'd like to discuss? I'd like to have one perhaps on active mobility, with a little bit of presentation, maybe from our friends in UNEP or Walk 21, Jim and Bronwyn. But yeah, we can have this every couple of months and then bring everyone together so we can sort of, share our knowledge. But yeah, if you have any feedback or suggestions for next sessions, please email me or the CHI Health email address. But with that, thank you so much. Please join me in thanking Maria Segui Gomez for her time, and thank you, everyone.